It's a reprieve for HIV, malaria and tuberculosis patients following the flag-off of essential drugs and commodities to the various counties. The flag-off follows a review of the stop order that had paralyzed operations at the Mission for Essential Drugs and Supplies, leading to the suspension of processing of orders received for USAID-funded commodities. The flag-off comes as Health Cabinet Secretary Dr. Deborah Barasa maintained that the country has secure stock levels of key drugs and commodities to last between several months to 2 years.
For 1 month, HIV, malaria and tuberculosis patients stared at an uncertain future following the suspension of the processing of orders received from the Kenya Medical Supplies Authority KEMSA for USAID-funded commodities. Essential drugs that had been stuck at the Mission for Essential Drugs and Supplies warehouse were finally released on Friday, following an agreement between the Ministry of Health and the United States President's Emergency Plan for AIDS Relief, PEPFAR.
After the stop work order, there was actually a cancellation of the contract with USAID for the program to support drugs. But with interventions from the ministry and the PEPFAR team, we have been able to restore that pipeline.
For a while, we had a bit of a pause in terms of these commodities moving. But today is a great day that we are here and you are leading us and reassuring the nation that Kenya has these essential commodities.
The commodities we are flagging off today will directly support millions of Kenyans affected by HIV, TB and malaria.
According to Health Cabinet Secretary Dr. Deborah Barasa, the country has adequate stock of essential supplies to ensure uninterrupted services.
Addressing these issues requires, number one, strengthening local manufacturing of pharmaceuticals and healthcare products. This will ensure HIV commodity security and foster sustainable growth. Secondly, integrating HIV patients into the National Health Insurance Scheme, which is the Social Health Authority SHA, to ensure swift distribution of essential commodities and also health service delivery for people living with HIV.
Counties have been urged to ensure there is fair distribution of the drugs across hospitals to ensure the intended populations are reached.
This is to avoid stockpiling in certain facilities or by specific individuals while others are suffering. It is our share. So can we distribute these commodities in a fair manner?
According to Health CS, Kenya has over 2 million packs of TLD antiretroviral drugs, with over 4.8 million packs set to be delivered between now and June 2025. Additionally, there are 510,100 ml bottles of nevirapine suspension, an ARV used for infants, as part of the elimination of mother-to-child transmission of HIV. The CS further said that Kenya has 18,432 tests of early infant diagnosis to determine the status of infants exposed to HIV. Health Cabinet Secretary Dr. Deborah Barasa has maintained that the drugs will be fairly distributed across the 47 counties. Nancy Okware reporting for Easy Friday, Nairobi.